Hello guys, I'm so sorry that I'm 10 minutes late. My bad. I just had to set up my laptop and it had decided to die, then needed to reboot, and it just took me ages to get sorted. So here I am. Um, Hopefully there are some people watching, able to watch live today. I know I did kind of advertise at quite late notice, but it's been a sort of idea in the pipeline for a while, and I just wanted to do it whilst it was fresh in my mind rather than postponing it to when I'm free. Um, Excuse the background. This is one of the only kind of decent rooms in the house. Yes, this is decent. Um, we're in the middle of redoing our house, so every room at the moment is a bit of a mess. Hi, Rachel. Hope you're well. So yeah, you'll just have to excuse the mess, but hopefully it won't put you off. Priorities first. Cup of tea. Rachel, can you hear me okay? Can you just give me a thumbs up or a comment if you can hear it all right? Because I have had problems with my microphone in the past. Hopefully you can. Yeah, I think so. Okay, so let's just get started then. So tonight I wanted to talk about postnatal depression, massive topic for me, as a lot of you will know that I experienced it myself. Brilliant. I also had postpartum psychosis, so mine was kind of a combination of the both mixed together. Um, and I don't know how much or how little people know about it, but I just wanted to kind of give you a bit of an overview of my own, not just my own story, but talk about it from a human givens perspective, and talk about sort of what you can do, things you can do to prevent it, things you can do to help it, but also what sort of things might make you high risk so that you can just be aware of it. I'll just grab my notes. Hang on a second. So a lot of people don't know actually that up to almost up to 50% of new mums, especially, so first time mums, experience some sort of mental health complications either during their pregnancy or in the first year of giving birth. So that's a massive amount of people, and a lot of, I would say, up to 50% of those people probably don't even go to the doctors or don't sort of ask for any help with their problem. So it goes unnoticed. And the only reason, to be honest, that mine was picked up was because it was at the stage where it was so severe that it couldn't be ignored. So quite often it can go unnoticed, even by partners and other family members. They can just kind of look from the outside and think that you've got it all together and you're functioning, but actually you're really, really struggling on the inside. And it's only those people that get it really severely or have the psychosis as well that actually get help. And it's kind of one of my massive bugbears, along with all other mental health issues really, is that you don't get the help that you really need unless you're so bad that you almost have to be hospitalized and you have to get to breaking point before you can actually get any support. And then when you do get that support, it's actually not good enough, and it's not the support that you need. It's not specific for your issue. So regardless of that, anyway, I don't want to rant too much about my own experience of that, and just wanted to basically talk about postnatal depression, make mums aware of it, make sure that you know what the symptoms are that you might need to look out for. Then you can, you might be able to identify it in a friend, for instance, or another family member. You might think, oh, actually, when I look back to having my first child, I think I might have had it a bit. And that's really common, but people just kind of assume that it's part of motherhood and then they just get on with it and keep going. So some of the things I would say to look out for, and there's loads, and every single person is different here. So some people might have one or two symptoms, some people might have 20 symptoms, and they can be completely different. But for me, the thing sort of standout symptoms initially were not wanting anything to do with my baby. So that, obviously, I knew that was not a natural thing. Hi, Katie. Hope you're well. Thanks for joining. And so, yes, obviously, not wanting anything to do with your child is not a natural feeling for a new mum. I didn't want to kind of get involved in any duties, any looking after her, so I actually avoided that completely and found other things to do. And I just, as a repeat that I've already said, mine was quite severe. So I don't think those are some of the most common symptoms. I think they're more sort of guilt symptoms that stand out for most people. So kind of wanting to be a good mother and not being able to, and feeling bad for not being like that. So for instance, a couple of other things that you might need to look out for. Obviously, you don't get sleep as a new mum anyway, but if even when you are exhausted, you're finding that you're too anxious to sleep, then that could mean that there's a problem there as well. Just be aware of your appetite as well, whether you're avoiding eating altogether or whether you're overeating to compensate for something. Just, it's all about awareness and balance, especially at the beginning, in those stages where your life has just completely drastically changed forever. It's a massive adjustment. Struggling to remember the other ones with me, for instance, because it was so full on. It's really difficult to pinpoint what happened when, but I know definitely at the beginning it was the feelings of sort of detachment from reality, really, but also from her. So I genuinely didn't feel any connection with her, didn't want a relationship with her, and actually what I wanted the most was just to be left alone and have somebody else look after her. So it's almost like I felt that I needed to be the one who was being looked after, and she would be fine on her own, which obviously is not a rational thing. That's not normal. That's not what I would normally think. But in that moment, that was my belief. I felt that I couldn't breastfeed because I wasn't good enough at it, even though the midwife said I was absolutely fine. She was getting enough milk. In my own head, it just wasn't an option. I was too anxious to be able to do it, and so that wasn't helping it to become any easier. It was horrendous, and that only then sort of fueled my belief that I was a bad mum and I was doing it all wrong. I couldn't cope and I wasn't capable. So those kind of thoughts, if you're having thoughts about not being able to cope on your own, for instance, when your husband goes back to work, that could be a problem. And not wanting, not having any motivation. Yes, you're going to be tired. Every mum is going to be absolutely shattered, but there'll be some sort of instinct, something in you that gives you the motivation to get up and do those night feeds, because you know you have to look after your child and you know that you want to, in most cases. Just have a bit of tea. So I'd love for anyone else watching, actually, to, if you have had it or know anyone who's had it, if you would mind sharing some of your symptoms with me, that would be really useful, just so that the other people watching, and when people watch this back on replay, they can they can have a look and share symptoms. I know from sort of my partner's perspective and other family members, they noticed that I was very uncharacteristically quiet, so I just withdrew completely. I didn't really want to engage in any conversations, and I spent a lot of my time just in my bedroom. I was just kind of trying to sleep or trying to lie down all the time. I was just saying, all I want to do is sleep. All I want to do is just go away and leave Aria, my daughter. And obviously with mine, as I said, I did have psychosis sort of thrown in there as well. So it can make it a very, very different illness. And that's why I was ended up, I had to be hospitalized because of that, because I was actually a danger to myself both myself and Aria. You know, so I was saying and thinking things that were not right, and that's why we knew that there was a problem. So if you're worried about having any of those intrusive thoughts at all I would say is don't sort of try, as horrible as it is to accept that you're having them, do not, dampen them or not tell anybody, because it'll only get worse. I was terrified about telling my family and my partner about the thoughts that I was having, because I thought, well, I'm just going to be locked up, you know, and but I had to do that to be able to get some help. I was having thoughts about harming my baby, and I was having thoughts about harming myself. And if that had, been sort of ignored or unnoticed, then it would have only fueled it and it would have been a lot worse. Would have taken longer to recover and all those kind of things. But we caught mine so early on that by 5 days, I was in a psychiatric unit and Aria was at home because I couldn't be with her. I wasn't safe to be with her. Bear with me. I'll just read Katie's comment. She says it's so easy to think thoughts that seem so irrational after, exactly, but at the time they're right there, real in your head. Well done you for getting through this. Thank you, Katie. You're absolutely right. It's, thoughts are real if you feel them. That's what I always say to people in counselling. If you feel something, then it's real to you. And it can be absolutely terrifying, and you don't know whether that's the real you or whether there's something wrong with you. And so that's partly why I was so scared to tell anybody. But all I can stress is please do, because the longer you leave that, the harder it will be to get better in the long run. And even considering my mine was so severe that I was taken away from Aria and I was put on suicide watch in an acute psychiatric ward, I still made a full recovery within probably about 9 months. And by the time Aria was just over 6 weeks, no, sorry, by the time Aria was 9 weeks old, I was home with her. And that is mega considering where I was. So don't be put off by the fact that if it's really severe, that's just how it is. You still recover. And I think in a way, I actually recovered quicker than I would have had it been mild, which I know that sounds crazy, but it just enabled me to have that head start with medication and get the support that I needed much quicker. Whereas if it had gone on at home, it might have taken a lot longer. I'll just read Katie's comment. Hi, Katie. Other Katie, sorry. I had horrendous PND with my eldest, who is now 8. So I'm assuming that was your first then, yeah. I never had help to overcome it, and now we have a strained relationship and bond. My anxiety is a lot worse when she is with me, even now. At the time, I didn't know what help to ask for, and I regret it every day. I'm sorry to hear that, Katie. That's horrible when you know that you needed help and you didn't get it. But all I can say is that, you can still make up for that, and don't ever feel bad about having any sort of bonding issues, because it happens to them at such a young age that it really, I know some people might say it affects them developmentally and things like that, but it really is such a short period of their life that you're poorly. That, with my daughter, as I say, I was away from her at the beginning because I was too poorly. And then even when I was introduced to her again, there was no bond at all. I was forcing myself to physically do the sort of duties with her, looking after her, changing her nappy. And it was a bit like a robot because I didn't want to do it. And I was really anxious around her, really angry, really depressed. All of those things. I used to scream and cry in front of her all the time. And at the time, I didn't think anything of it because I wasn't bothered if it affected her or not, which I know sounds awful, but that's just how I felt at the time. Whereas now, looking back, it makes me sad that I did that, but I can see already, she's only 2, but I can see that it's not affected her, and she's a really happy child, and now we've got a great bond. And Katie, what you're saying is, it sounds more to do with regret, about that time, but all you can do is focus on improving that, because we know that you can't change the past. Unfortunately, you can't change anything that's happened, but what you can do is change the future. And if that's something that you feel strongly about, then work on embracing that and making sure that you try at least to make up for that, if that's how you feel. But don't worry, it will not have it will not have affected her badly. And just in terms of your anxiety now, I know exactly where that's coming from, and it might be a good idea to private message me afterwards, because I can explain to you what that is. It's something called a pattern match, and it's when something triggers a memory or a reminder of the past. And that happens a lot with postnatal depression, with any sort of traumas, actually. Because my mum, for instance, had postnatal depression and psychosis with my sister. So when I was going through it, she had all those triggers that were just putting her back in that place emotionally. And I'll try and explain to you what that is, if we chat another time, if you want to. But thank you for the comments. Keep them coming. So I just wanted to share with you again, I did say this at the beginning, the statistic that up to half of pregnant women, first-time mums, will experience mental health issues, or they will develop whilst they're pregnant or in the first year of having their baby. And I know I've just mentioned that my mum had postnatal depression and psychosis, and I did, but she had it with her first child, then went on to have me. So I know, I'm hopeful that if I did decide to have another one, I can be okay again. It doesn't mean to say that it's going to happen again. She went on, she had a full recovery like me and went on to have another child. And I think that's really important, because if you're expecting it, you can actually create a predisposition towards it. And that's exactly what happened with me, because I knew that my mum had it with her first child. I went into that thinking that could happen. Probably won't happen, but just thinking it could happen actually planted a bit of a seed, I think. And there isn't enough research yet to suggest that there is actually a genetic component. So a lot of people would try and argue that, I was going to get it regardless because my mum had it, but actually that's not the case. There is a genetic component with things like the psychosis and schizophrenia, but depression and postnatal depression, there is no genetic component. So actually, either it's just that you're creating that with your thoughts about it, or it can be a predisposition. If you've been brought up around somebody with a mental illness, for instance, you can then go on to develop it. But by the time I was born, my mum was better, so I didn't have that growing up. I think it was more a case of me sort of half expecting it to happen. And I'll go on to talk actually about, there's lots of other things along the way that can affect it and obviously increase your chances or your risk of getting it. But that for me was one of them. So what might happen, or what might impact, your chances of developing postnatal depression or increase your risk, for example. So things like toxic environment. So that could be your work environment. So a toxic environment just means, it's quite self-explanatory. It's an environment that doesn't nourish you. It actually takes away from all your energy. It basically challenges you, but not in a good way. So what it's doing is using all your energy and resources and not giving anything back. So a lot of people refer to their workplace as a toxic environment. If they work in a place where people don't value them, for instance, they're overworked, they're stressed, that's a toxic environment. Some people can come from a toxic environment at home. if they've come from an abusive home, for instance, or a home where their parents are arguing all the time. That's a toxic environment. So those kind of things can, can increase your chances or put you at a slightly higher risk than the average person, let's say. Obviously, stressful events will impact your chances. So try, if you can. I know you can't control everything that happens in your life. Clearly, I did not do that. But if you can eliminate stress as much as possible during pregnancy, then that's going to help. Because looking back at my own pregnancy, I had about 3 sort of big traumas and then lots of small stressful events as well. And it was just an accumulation of events. And then the actual giving birth was that was just the straw that broke the camel's back for me. That was as much as I could handle emotionally and physically. It just tipped me over the edge. So in those, I would say at least in the year before Aria was born, and in the first year afterwards, I moved house 4 times. And moving house is like one of the top 5 stressful events to do in your lifetime. And I did it 4 times within 2 years. And as well as that, I had a sort of family trauma, no, 2 family traumas, sorry. I had a work trauma where I lost my job. I was suspended from work, received allegations that weren't true. That all went on whilst I was pregnant. And yeah, just kind of one after the other, really stressful events that at the time I was just getting on with it, thinking, well, it's fine. I don't need to worry about any of this stuff anymore because I'm going to have a baby and it's all going to be great. And that was really naive because I did not expect to be affected by those things that much. And then the labour itself kind of was a bit of a textbook labour, really. It couldn't have gone, apart from it taking a long time, it couldn't really have gone any better. But because of the sort of physical trauma of that, the exhaustion, and that's what just tipped me over the edge. And I know that lack of sleep obviously has an impact. And the couple of days before giving birth, I didn't sleep because my contractions lasted for about 2 to 3 days. And so I went into it already sort of on a bit of a low. And that, just coupled with losing quite a lot of blood, probably having too much gas and air, really, really affected me just spilled my tea on me, in quite a big way. And I've since actually, if anyone is interested, I've since found out from speaking to I can't remember the name for it, but a lady who basically analyzes blood. She found out that Entinox, which is the gas and air that you have, it basically depletes all your vitamin B12 levels. It basically wipes it out. And vitamin B12 is linked with depression. And it takes a really long time to build it up again if you lose it. So that will have had an impact, as well as the physical loss of blood, and kind of the combination of all of it, really. Just have a bit of this before I forget, because it will have gone cold. So I've just remembered where I was up to on here. So we were talking about stressful events, and so eliminate stress as much as possible. Obviously, you can't change what's going to happen externally, but you can change what you do and your response to those events. And resilience, make sure that you build your resilience before planning a baby. Especially if you've had an existing mental health condition, or if you've had postnatal depression and want to have another child, you need to make sure that you have put everything in place possible to reduce your chances of getting it again. And so that includes things like going to counselling, to learn skills to build your resilience when stressful things do happen. Making sure that you've got a support network in place for if things do go wrong, or if you struggle, You can call on friends and family to help you out. Join peer groups so that you can meet other mums. It might be that you want to join specific groups like breastfeeding groups, or I don't know, like music groups or whatever, but just make sure that you've got all that planned so that it's in it's in place before you actually have your child, because that can have a massive difference, a massive positive difference, especially when you are depressed, you kind of withdraw, you want to spend time on your own, you want to just kind of shut the outside world out, and that is the last thing that you should be doing. That's just going to make you a hell of a lot worse, and it's going to make your recovery quicker. You need to be pushing yourself and doing things out of your comfort zone. I know it sounds hard, and it is hard, but it's the only way to get better. You kind of have to commit, and there's so much stuff that you can do if you're at home, for instance, in your recovery. But if you were hospitalized like I was, it's a very different thing, because you only have what they have on offer, if that makes sense. So if you're in a place like I was, where it was, I don't want to swear, but it was awful. They told me I was too ill for therapy, and just because I didn't feel like joining in with any of this sort of activities, they didn't really encourage me. If I just said no, that was it. They'd be like, okay. But I needed to be forced to do those things. And the time that I started to improve was when I got home. I came home on a weekend visit to just sort of trial it, to see if I was ready to come home with my baby, and I never went back. And that's because I immediately started improving. Once I was at home, I was able to regain a bit of control over my life, and that gave me a bit of confidence. I thought, actually, maybe I can do this. Maybe I can look after Aria, and maybe I can still be a partner and be a mum as well. It has massive stress on your relationship, I'm not going to lie. It will either make or break you, but be prepared for that, because again, if you go into it with a naive attitude, then it's going to be a lot harder. But if you go into it with a realistic head of, this is what could happen, but you've got steps to prevent it from happening, then you're in a much, much stronger position. So that's resilience and support. I did touch on a little bit about the predisposition towards it, but don't let that sort of scare you and just make you think if there's someone in your family who's suffered from it, then that means you're going to get it, because it's not the case. You can still prevent it. And I'm going to be, hopefully, one day working on this with my sister, because my mum had postnatal depression. I've had it. She's now thinking, oh, great, shall I have children or not? Because if that's going to happen, then I don't know if I can go through that. She's seen me absolute breaking point and would love to have children in the future, but thinks, if that's what you've got to do to get one, then is it worth it? So I'll be able to do some work with her about building her resilience, helping her with making sure she's got a support network, doing some counselling with the whole predisposition thing. And I know that she'll be fine. I know. She won't know that I'm talking about her now, because she's not talking about having children yet, but it's just something we've kind of discussed informally about the future. I'll just read Katie's question here. On the topic of relationships, of course it can affect the men too, and it's just not spoken about for them. I'm so glad you brought that up, because I would have forgotten, but it's a massive, massive area, this. And absolutely, I'm sure my partner won't mind me sharing this, but he had to be signed off work with stress for 4.5 months whilst I was poorly. So it wasn't just the transition of becoming a dad, but he also had to go through me being very, very poorly, being away, both me and Aria being away from him in the hospital. He was absolutely beside himself. And men don't know, unless somebody's taught you or if you've been through it before, then how are they going to know how to help you and how to support you? They don't know what the right thing is to say. And it's just sad because, like you've just said, Katie, it's not talked about and there really isn't support. I mean, in our area, there's one sort of charity for postnatal depression, and they do offer, or they advertise for a dad's support group. But when, you know, when he actually tried to access it, it was weeks and weeks away. And then it wasn't even, you know, he actually just got sent to like a kind of CBT group. It was nothing to do with postnatal depression, and it was nothing to do with specifically men. So there really, really isn't. And I kept saying, go and join a dad's group, go and do this. But ultimately, he was also suffering with depression. You know, he never went to the doctors, and they never said that. But I know that. I know he had it, and that was as a direct result of me having it. So, you know, our poor little girl, under the age of 1, had 2 parents that were seemingly incompetent, both depressed, both, you know, really stressed, both with themselves and at each other all the time. And it must have been a horrible environment. But we got through it, and she's absolutely fine now. I mean, she's amazing. You wouldn't know that anything was ever wrong, even both with me and my partner as well. But you just have to, all I can say is you have to be patient, and that is really, really frustrating. But if you both know that there is light at the end of the tunnel, and it's not always going to be that way, then you will get through it. You know, he was really, really strong for me, and he kept saying, babe, I don't know how long it's going to take for you to get better, but I know that you're going to get better. And that's what you need. And even though I couldn't see that, he was better than I was, so he knew. And he knew from speaking to my dad and my mum about their experience of it, that they went on to have another child and did get better. And so you've got to have faith in each other. And if you don't, then just be patient and sit it out. Don't make any rash decisions about leaving each other when you're in that emotional state, because you will regret it. You just have to be there for each other. I hope you don't mind me eating some chocolate. Very important business. So I just wanted to touch on symptoms again. So anyone new that's joined, do you have any sort of standout symptoms for you that helped you to recognise that you might have had postnatal depression? I think it's important also to mention that the sort of speed of onset and the duration of the illness itself varies massively. So I know some people where it's not developed until the child is almost 12 months, and at that point you can't I know that you can't get help, for instance, in mother and baby units if your child's over 12 months, even though it can occur up to you know, any point, sorry, up to 12 months. With mine it was immediate. Some people it's 2 months down the line, some people it might be 6 months down the line. And then your recovery as well just depends on A, you know, the amount of support that you have, whether it's the right support, and B, how resilient you are. So it can take up to 2 years. So anyone else want to share any symptoms before I move on? I hope that you are finding it interesting. I really didn't plan this. I didn't sort of structure this session at all, because I knew that I'd end up having loads to say about it, and I'd probably go off track. If anyone has any questions as well, I'd love to answer them. Any questions about sort of what the difference is between postnatal depression and psychosis, or any questions about my own experience or how I would treat it, anything like that. From a human givens perspective, you would go about treating postnatal depression in exactly the same way as normal depression. So it would probably take around 3 to 4 sessions depending on how severe they were. I had it myself when I came out of hospital, and it made my recovery sort of went straight up really quickly. I was kind of at the hospital, I was down here, and then I went up a little bit when I came out, and then I stayed the same for a bit. Then I had some human givens therapy, and it went whoosh. And then, yeah, it just happened so quickly after that. She was amazing. She did some work with both of us as well, because she knew how much it had affected both me and my partner. And in fact, he still has therapy sometimes now for it, and that's completely okay, because he had to be so strong for me that there's so much sort of still there that he's not dealt with, and I'm sure that for me there is a lot as well, but I'm actually enjoying, I'm enjoying life now, and I'm enjoying being mum. I don't feel the need to go back there and delve into all that stuff right now, because it's not part of my life at the moment. It's part of my past, but that's okay. It's made me who I am now, and it's made me massively passionate and motivated about helping other mums, which is what I needed, a bit of a kick up the arse to do something different. Hi Lee. Sorry I keep doing this. It's a cold room and so my nose is running. Can hormones bring on PSD? I'm hoping you mean PND, but I think that's what you mean. Yes, absolutely. Sorry, I'll just finish this so I can talk to you properly. You joined me a bit later on, so it may have been covered earlier on when I was talking about how with me there was a sort of accumulation of stressful events, and then the labour was the final tipping point that sent me over the edge. And so that would have been a combination of being exhausted, it would have been hormones, it was the trauma and pain of having birth, losing a lot of blood, and a combination of all those things. But definitely your hormones are so all over the place, both during pregnancy and for the first 12 months really afterwards. It has an enormous impact on your mood. Some people's levels are obviously higher than others, and some people are okay with that. Some people it doesn't affect them in the same way. But I think where mine sort of I'm not sure what the word is, but the the reason mine changed so much was because of having too much gas and air and Entonox, because that affected both the hormone levels and my sort of vitamin levels in my body. And another thing to mention actually is that when you give birth to the placenta after your baby, that has all the hormones in, and if there's any retained placenta, so if any of that, even if it's a minuscule bit, is left behind, then that plays havoc with your hormones for months and months afterwards. And that is another thing, unfortunately, that happened to me. So that will have impacted. About 6 months after Ari was born, we found that I actually still had some placenta, and so that had to be surgically removed. And that, because your placenta literally is a bag of hormones and nutrients, and so if that stays behind, then it's going to be producing the hormones as if you're still pregnant, even after you've had it. I'm not sure if I've actually answered your question, Lee, but in a nutshell, the answer is yes, but I don't know enough science about why that is. That's why the baby blues thing happens, and that happens to virtually everyone. It happens to about 80+% of women. So you usually get the baby blues around like 4 to 10 days afterwards, I think it is. It might be up to 2 weeks. And that's just a sudden, spike in the hormones, making you really emotional. And then after that, it usually tends to settle down. But for some people, it doesn't. And that's when it's different from baby blues, because yeah, if it lasts for more than 2 weeks, then it's not baby blues, it's something worse. But you would know as well, because of the types of thoughts you'd be having postnatal depression or psychosis is very different, because you're not just feeling low, you're having suicidal thoughts, you're having thoughts about harming the baby, you're having sort of feelings of detachment from reality as well as from your child, and all those kind of things. Baby blues is more about sort of usually feelings of guilt as well, sort of mixed in, just overwhelmingness, if that makes sense. I'm loving the comments, Lee. Yeah, the gas and air thing, that's a whole really interesting thing that I want to do more sort of research about. But I'm speaking with somebody about how they can help me with that, and they're hopefully going to analyze my own blood results from that period of time to see how it affected, because they know that there's a massive link between vitamin B12 and depression. And what gas and air does, as I mentioned a bit earlier, is it completely depletes all your vitamin B supplies in your body, and it's one of the vitamins that takes the longest to kind of build back up. So if you've not got it, it can take years, and you might have to take supplements forever. So if anybody has had postnatal depression or thinks they might be suffering from it, then I would highly recommend taking a B12 supplement. It will help with your mood and sort of feelings of general like fatigue. Another thing to mention is that if after your birth you lost a lot of blood, you should be taking iron tablets, and if you're not, then that's going to be affecting your mood as well. Thank you for those questions, though. I think I'd love to say more, but I have been talking already for 42 minutes, so I might just leave it open for questions now, unless there's anything really specific that anyone wants to ask me. It's such a big topic that I could sit here all night and talk about it. But this will be available on replay, so please do watch it from the beginning if you want to, if I've missed anything out. So my only sort of tips I would say for for overcoming it would be, make sure that you've got support from your family, and if you haven't, then talk to them and say that you need it. Contact local charities or find out what's out there, what support is out there. There's things like Home Start, they can come out and see if you need any help around the home. Just do things like, if you don't have the motivation, then if you don't have the motivation or enough time to look after your baby and do everything else around the house, then get a cleaner for a few weeks. It's not going to hurt. Just get a bit of help, and it's okay to ask for help. Tess Lloyd, hi Tess. How can you tell if what you have is sleep deprivation or PND? I think, to be honest, that would depend on the period of time that you've had those symptoms for. So usually sleep deprivation is or can be rectified in quite a short sleep. So you don't necessarily need to catch up on loads of sleep. If you've lost loads of sleep, you actually only need a little bit to sort of replenish that, if that makes sense. And so when you're sleep deprived, you have a short temper, you get irritated, get angry more easily, less motivation, those kind of things. Postnatal depression would probably be thoughts and feelings more related to being a mum or related to your child specifically. So things like not wanting to look after them, not wanting to look after yourself, not wanting to see your friends, for instance. It's more things that you would normally, will naturally be drawn to, that you're pulling away from. I'm just trying to think of my own experience, because at the beginning mine was certainly sleep deprivation, I think, but then that quite quickly, if you don't rectify the sleep, that can turn into psychosis, because you can actually artificially induce psychosis in somebody if you basically stop them being able to sleep. So it's massively important. If you're at a point where you think you are really sleep deprived, then you need to ask for help from your family, even if it's just, take my child for a night because I need to get some sleep. Then you absolutely need to do that. Even if it's a few hours in the day, just get your head down if you are really sleep deprived. So I hope that makes sense, Tess. It is difficult to distinguish the two, but I think that the thoughts and feelings are quite different. And the sleep deprivation feelings are also a lot of the time more physical symptoms as well as psychological, but more physical symptoms, whereas the PND would be probably very few physical symptoms, but lots and lots of emotional and psychological symptoms. Good. Okay. So I'll stop talking for a minute, see if anyone's got any more questions, and then we'll wrap it up. Katie, this sort of conversation should be part of NCT or NHS. Yes, this is what I want, and I've been trying to, well, I say I've been trying to, I haven't tried hard enough yet, but it's on my sort of long to-do list, is to contact local hospitals, antenatal classes, NCT. I have been in touch with the NCT a few times online, actually, to just say to them, this needs to be part of the antenatal curriculum. Because I know for me, I don't know how, it depends probably how recent you've been to these kind of classes, I guess, but for me, postnatal depression was not mentioned once in 6 sessions, whereas 50% of women will experience some sort of PND. It's ludicrous. Like, how can they not tell us about that? I only knew about it because my mum had it, and that's not a good reason to know about it. I need to be taught about it, taught what to look out for, what your partners can do. They need to know how to spot it and how they can help you, and we need to know what then you can do to get you out of it. So I'm so glad you brought that up, because that had completely, passed my mind. But that's something that I have written about previously in one of my articles or blogs. It's just, it would be so easy for them to just say, right, every person who goes to antenatal or NCT classes has to do at least one compulsory workshop, for instance, about this. And it's not meant to, scare people, because I think that's why they don't do it. They're worried about scaring people, but surely that's better than having to pick up the pieces once they've already got PND. It then costs a lot more money to look after that person. So I don't get it. And I've tried to contact my midwives, actually, that I had and did the antenatal classes with, and they were just not interested at all. They said those words pretty much, that we don't want to scare people, when it's not actually it's not a very common thing, and what you experienced was very severe. That's not really the support that you need, is it? Like, surely that's a perfect example of why they need to talk about it. Anyway, don't get me going on that. Right then, if anyone has any more questions after I've stopped the video, then I will answer. It might not be straight away, but I'll leave this up on my page so that you can replay and watch it back whenever you need to. Thank you so much for everyone watching and listening and interacting today. Considering I gave you about 5 minutes notice that I was going to be on, I think we've done quite well. I'd love some feedback as well afterwards if anyone has any. And I'm going to go finish my cup of tea and then have a little relax because it's been a long day. Lots of love to everyone. Bye bye.